Ora koutou, ko Francois Barton te ko ingoa. Lovely to see everybody coming on stream. For those that don't know me, I'm the Chief Executive of the Business Leaders Health and Safety Forum. And for those that do know me, rest assured I'm not going to be doing all the talking. We've got Jason van Schie here from FlourishDX who's going to help us have a very hopefully engaging and stimulating conversation about a topic I know that's close to all of your hearts: mental health and wellbeing at work. This is the first of our webinar series we're doing on wellbeing. Earlier this year, we sort of thought, how can we provide an opportunity for the many people across the forum community to engage with experts from across the Tasman and here in New Zealand on this issue that we're working with. And so we thought, let's embrace the technology, which COVID has proven for us highly effective. And so we've been really impressed with people's response. So thanks for your support for this approach and for our first one with Jason. I just completed a round of connection calls with CEOs just the other week, and one of the number one issues that came through was for CEOs looking at the year ahead was the challenges around well-being. And I think you don't have to be a rocket scientist to see a bunch of both social and economic challenges that are going to probably be not going away in a hurry: cost of living, job insecurity, and others, coupled with the fact that I think people's batteries were flat post-COVID anyway. Added to that, anyone that's been interested in this issue has been probably following or been aware of or hearing drumbeats about a range of activity going on across the Tasman and Australia. So we thought it was a wonderful opportunity to have our first call with Jason. I'll let Jason introduce himself, but Jason van Schie with FlourishDX. FlourishDX are a well-known and one of the leading and initial consultancies working in the area of psychological health and safety or mentally healthy work, plugged in across a whole range of clients in Australia, big and small, and in New Zealand indeed. So we're lucky to have Jason talk to us about what he's seen across the various states in Australia and whether there's anything there for us to be mindful of or thinking about that may find its way here. And also, Jason works with a huge range of clients that can provide us a bunch of insights of what are they both wrestling with as well as finding most helpful. So that's basically the structure of today's call. We'll try and keep it. I've got a range of questions, so I'll probably look to facilitate in a way a conversation between Jason and me in the first instance. If we could put questions you've got on the way through into your chat function, we'll keep an eye on those and bring them up as and when appropriate, and we'll make sure we've got some time at the end for any we don't get to. We are recording this, so we can take some highlights from this and make them more available. And Jason's got a few slides to share with us at some point, and he's already agreed that he's quite happy for us to send those out after. So we'll be looking to be able to share some of those things going forward. So any questions, throw them in the chat and we'll do something and we'll make sure we get to those en route. So Jason, rather than me lead you through me trying to read your bio, I might let you introduce yourself and FlourishDX, and then we can go from there. So Jason, over to you.
Cool. Thanks for having me, Francois, and thanks for creating this great forum to talk about psychological health and safety. So as Francois said, my name's Jason van Schie. I'm the Managing Director of FlourishDX. I have a background in organisational psychology. I've been working as a psychologist for around 20 years now in Australia, probably 2007, 2008, so what's that, about 15 years or so ago, started to delve more into human factors, cut my teeth on things like fatigue risk management and fitness for duty and alcohol and other drugs. But in 2017, really decided to focus my attention on psychological health and safety. A lot of that kind of stemmed from I saw what companies weren't doing well in terms of workplace mental health, where there was a large focus on things like building resilience and, here's how you do mindfulness and here's how you manage stress better, without first of all thinking about the harmful effects potentially that work was causing on them, and basically just telling people, this is what you need to do to survive in a context that we've got no interest in actually doing anything to change.
Yeah.
So like fatigue risk management, it's very much a shared responsibility for mental health in the workplace, but I saw a lot of that was being pushed down on poor employees to manage themselves in unideal situations. So yeah, I got really interested in psychological health and safety, thinking, well, this is the way that companies need to go. We need to supplement the stuff that we're doing at that individual level with more on what can the organization do, what's within their control to create conditions for people to stay well and optimize their ability to flourish. In terms of FlourishDX, we basically are an end-to-end provider in psychological health and safety. We provide consulting, we provide education, and we have been investing in the last 5 years in a technology platform that largely assists clients to consult with employees at scale regarding their experience of work. We've gotten very good at being able to quantify the risk associated with the experience of work, so psychosocial hazards, as we'll talk about no doubt today, and then helping them to identify what are the things that they can do to improve that experience of work and make sure that those actions are done well. But I do love the education component of what we do, Francois. Obviously, I do lots of webinars like the one that we're doing today. So I'm glad that you're up to doing an interview style rather than me just presenting from a PowerPoint slide. It mixes things up for me a bit. Another way we educate is actually through our podcast though. So if anyone is interested in the topic after hearing us talk about it today, and I know there's going to be a whole series of these events with other people as well also presenting. And in fact, you'll probably find that all of them have probably been on our podcast at some point as well, including Francois.
Yeah, great.
Yeah, so but if you are interested, there's a huge back catalogue, over 200 episodes now, where we do have guests from all around the world who really share out their knowledge, as Francois did, on this topic and what companies can do to move forward. The other thing that we're doing, which we're really excited about from an education perspective, is bringing the community together. We've been building this community around psych health and safety for the last 3 years, largely through the podcast and through other smaller events. But this is going to be our first big 2-day conference where we're expecting 300 to 400 people to be there in person. There is virtual attendance too if you don't want to travel across the ditch to come to Sydney for the event. But we'd love to see as many forum participants or members as possible there. And I have passed along a discount code as well that will take 20% off all tickets, and that will be circulated following this event too. So, I'm very passionate about education because we have found that despite this being best practice, what we're going to be talking about today, and definitely what is needed to actually help us to achieve the outcomes that we always wanted to achieve when it came to mental health in the workplace, companies haven't taken it up. And so we need to continue to educate and show, well, this is the benefits of this approach and this is how you do it. And so we're looking forward to doing that through both leading subject matter experts as well as some great case studies from companies who are doing it well at the conference. But yeah, that's enough about me. I'd love to start getting into the topic today, Francois.
Nice. Well, look, thanks, Jason. And it's really affirming for us. I think the pathway, the forum's been working for the last 6 years, and we've been sort of in lockstep behind a little bit behind you guys, and we're working alongside this idea of how do we look at the work, not just the worker. So the work and the worker. The fish or the aquarium, as I often have stolen from someone else in this space. So I think I just want to acknowledge, I think the leadership and work you and the team at FlourishDX do in that workplace element of those work factors is simply magic. I'm keen to probably split the conversation into 2 parts. One, and I'd like to start with almost what I call the system or the Australian context, what are we seeing? Because we're hearing things about regulations flowing through, about a different sort of enforcement approach around psychosocial risk management. And so I think it'd be useful for us to get a sense about what are you seeing across the various states and at a federal level around that. At the back end of the conversation, I think we'll get into actually what are you seeing occurring within the organizations you're actually working with more directly, because on the call, we've got 156 at the moment. We've got a mix of both chief executives and functional leads and advisors in this space. So we've kind of got a really interesting cross section of those organizational leaders that are going to be involved. So we'll start with the system. So what are you seeing across Australia at the moment around psychosocial risk and mental health at work?
Yeah, so for those who are unaware, we've been in a period of regulatory reform in Australia since 2018. So there was a review done of our Model Workplace Health and Safety Act, which every state in Australia now subscribes to, barring Victoria. Victorians are special, they like to do their own thing, as Francois would know. But that is actually the same act that HASWA, your 2015 act, is based on. Basically, it was very much a copy paste from what I understand. But essentially, in the act, there is the primary duty of care, right? That employers should have working conditions that do not cause harm to employees. And that harm was always supposed to be not just about the physical harm, but also the mental health harm. And what we found, though, is that employers didn't read it that way, and the regulators didn't think that was strong enough to enforce. So in 2018, there was a review done of the Act to look at what could be done to modernise it and to improve it from the initial 2011. And out of 34 recommendations, Murray Boland, who's going to be presenting at our conference, by the way, she made 34 recommendations. The second one was, we need regulations dealing specifically with psychosocial risk. Because like I said, it's not a new obligation, but we needed clarity around that obligation, that work shouldn't cause people harm, including psychological harm. And so over a period of 5 years, what we've seen is that we have been proceeding with, drafting that amendment to the regulations, or bringing out these new regulations. At the same time, there's been corresponding changes in our industrial relations legislation with what was called the Respect at Work Bill, which very much focused on specific psychosocial hazards, so more behaviours in the workplace that can cause people psychological harm, focusing mainly on sexual harassment and gender-based harassment. But what they did when developing, amendments to the Sex Discrimination Act was go to the new model regulations in Australia for managing psychosocial risk, and basically cut and paste from that and going, well, this is now the positive duty that all employers have under industrial relations legislation in order to prevent sexual harassment from occurring, not just having good policies in place on how do we investigate and punish perpetrators of sexual harassment. But what the focus of these regulations has been on, we need to think about mental health in the workplace with a health and safety lens. And that means that if we're trying to prevent harm from people, we can't just focus on self-care. We can't just focus on having policies and education. We need to apply a hierarchy of control type thinking, where we need to be seeking to eliminate hazards where possible. And if we can't eliminate them, we need to reduce risk so far as reasonably practicable, with a focus on work redesign. How can we make work better so that it isn't causing people harm? So there's a real focus on things like work demands, like work overload, role ambiguity, poor supervisor support, behavioural issues like bullying and harassment, but even things that we don't talk about often, like poor organisational justice, which is all about transparency around how decisions are made within organisations. All of these things we know can have a detrimental effect on people's mental well-being. And now organisations are really being forced to think more upstream around how do they prevent people being harmed by these things that are largely within the employee's control, rather than going, mental health is an individual issue. So all we're going to do, if we're going to do anything, is just provide people with resources.
So Jason, I'm going to just jump in there. So I think that, like, the principles of where those regulations are pointing us to, I think I'd hope wouldn't be new to anyone on this call. If they are, they're certainly within reach from a bunch of existing frameworks and discussions that have been going on in New Zealand in the last 5 or 6 years. I think the bit that I can imagine popping into some people's minds is that the subjective nature of what psychological harm looks like, the nature of some of those factors you talked about, what might be harmful for one might not be harmful for the other. How's it playing out with sort of a regulatory requirement which introduces the role of enforcement tackling in those? How's that actually playing? What's your observation that you're seeing businesses? Because it feels like there's a bunch of inevitable ambiguity that sits in there that I think is understandable, and that's part of the leadership work. But once you start to put regulatory requirement and enforcement and compliance implications around that, I could see that both having more people doing it, but how we do it might be around what a tick and flick, or how do we cover our ass, or do we lose the hearts of them? What are you seeing flow through there?
Yeah, and I'm not going to lie, like, there are some companies that we are observing doing that, going to the health and safety leads and saying, hey, what's the minimum we need to do to be compliant? Or can we just do a gap analysis and say that we're done? The good thing is that regulators are educating and holding organisations to account, and going, well, you need to have a safe system of work around this. This is not a one-off survey. It is not a one-off education program. It's not just a policy. You need to demonstrate that you have a process in place for consulting with workers around their experience of psychosocial hazards, that you've got this updated in your risk register. You need to be thinking about the controls that you've got and making sure, again, they're higher order controls, but you also need to make sure that you are measuring and monitoring these controls. If you're saying, you got flexible work arrangements as a control, for example, how are you actually measuring that is having the desired influence on reducing psychological injuries? There's so many opportunities for regulators, like low-hanging fruit. There are a lot of injuries occurring in Australia. For example, our workers' compensation scheme is a bit easier to make claims for mental injuries than in New Zealand. New Zealand, I believe it's only really PTSD, like exposure to trauma, where people can make claims. In Australia, people can claim for burnout, depression, anxiety caused by work. And in Australia, there's been close to 12,000 serious claims, so 2 weeks or more, claims requiring 2 weeks or more off work in the last reporting period. That is up like 70% over the last 7 years. So, but there is opportunities for regulators to go, well, look, I can see that there's a bunch of injury claims coming from, this particular workplace, or there's complaints coming from a particular workplace. And they are now looking for opportunities to make, to showcase, I guess, the regulations in force. And there's been some really interesting examples recently in both Victoria and New South Wales, where in the convictions of these companies where they have had these injuries occur, there's been a focus on, well, they didn't have a safe system of work to prevent this from happening. And they'll even point out things like they never actually completed a risk assessment. So there's always this, like, many companies think, oh, we're doing the right thing, and we've got EAP in place, but they haven't actually thought about what is the root cause of why people might be becoming unwell, and what's within our power, and what is our obligation as employer to prevent that from happening. So yeah, the regulators now have enough teeth in regulations to take cases when they're seeing instances of people being injured. Interestingly, there's been a large focus on sexual harassment and sexual assault. That seems to be a common thing. So it's interesting, and something for New Zealand to think about or look at in the future, that now sexual harassment, sexual assault is actually being dealt with as a health and safety matter. The legislation is stronger and the penalties are larger when it comes to health and safety legislation, rather than just an IR matter. Because we're talking about harmful behaviours that cause people psychological harm, often very long-lasting psychological harm. So I've gone on a couple of tangents there, but
there's a couple of things in there for me. So I mean, what you mentioned around the compensation element, and obviously in this reform, it's interesting. The Minister for Workplace Relations and Safety has just signalled a desire to review our Health and Safety at Work Act over the coming year. So it'll be interesting to see what submissions bring forward in this. I'm just wondering, Jason, you said that from a compensation perspective, it's easier to lodge a claim. So I'm interested to hear a little bit more about, but just quickly around, what does that look like in terms of what's the official sort of cost burden of that looking like, and what's the sort of sense of it? Does that feel reasonable, and are people sort of not comfortable with the performance level, but again, the subjectivity of harm and that concrete material cost? That I'm interested if there's any discussion around that. But secondly, if you were to run a hypothetical, if you didn't have that official data giving you a national baseline around what's the rate of mental harm from work, do you think it would have been the second recommendation in that reform? Because the net result in New Zealand is we do it more through survey, given that ACC data doesn't provide an official monitoring, an indicator of harm level. So that's where I'm sort of coming from on that. So tell me about the compensation piece, quantum, any sort of discomfort around what that's really about, and do you think without that official data they would have gone down this harder approach?
Oh yeah, no, it's very much needed, and in fact, it's really interesting because and I'll show you some stats in a second. I'll bring up a slide or two. But in Victoria, the work cover, all the workers' compensation schemes are different state by state, right, in Australia, but the work cover scheme in Victoria is close to collapse. I think they're like $1 billion in the red or something like that. A large amount of that is attributed to this increasing frequency and cost of mental injuries. And they've published some updates to that, which really tackle, I guess, the duration of psychological injury claims and how people can claim and kind of, it's making it harder. Whereas there was a review done of like the reform, and they said, well, what you really should be doing, because Victoria are the only state in Australia not to have regulations in psychosocial risk. So the recommendation was, rather than changing the insurance scheme and making it harder for people who have legitimately been harmed doing their work, why don't you actually force companies to actually prevent people from getting harmed in the first place? That's where the focus should be, like it is in the rest of Australia. But there is some really good data in Australia, right, regarding what is the cost burden. And the interesting thing with this is that insurers now are really getting in the game because it's hitting them, right? So yes, companies, workers' compensation insurance premiums are going through the roof. I mean, last year in Victoria, I think it was about a 46% increase in compensation premium. And, a large amount of that is due to these mental injuries. So Safe Work Australia every year summarise all the workers' compensation stats, and every year they also look at mental health conditions and pull that out from all other claims. In the last reporting period, the median amount of time now that people spend off work when making a mental injury claim is 34.2 weeks, so well over half a year. And that's in comparison, if you strip out mental injury and look at all other types of claims, slips, trips, falls, musculoskeletal, all the rest, 5.4. And so the cost is obviously a lot greater, 58,000 versus 12,000. But just looking at that on its own, like the total number of claims, 9.2% of the pie, the cost, it doesn't give us the true picture of how big a cost burden it is in comparison to everything else. What you need to do is to look at the amount of time that people are spending off work, right, for different injuries that is compensated for, and that increase. So mental injuries, the time off work compensated for, account for 39.1% of the whole pie, compared to everything else, right? And the alarming trend is it's not just 69% of all claims that have gone up. When we're talking about time compensated off work because of the increase in complexity, not just frequency, it's 304% increase. So this is why, regulators, insurers, they're all coming together going, hey, we need to make sure that employers are doing their bit to prevent harm from occurring in the first place, rather than, I guess, in the past, risk managing this in the past by paying insurance, the insurance premiums. The insurers aren't going to cop it for much longer because it's not sustainable.
I mean, that's eye-watering.
Yeah.
Jason.
Yeah,
and I mean,
absolutely.
I'm not expressing this opinion myself, but I can imagine there'll be almost a level of climate denial about are all of those real? I mean, these are based on sort of like medical assessments to get to that level. I mean,
it's not just self-report. I've been injured in in doing my duties. It has to be a medical assessment that is actually attributed that back. And we're talking about serious mental injury claims here as well. That's 2 weeks or more. And so you can't just it's not just a sick note from the doctor saying, Johnny's a bit stressed. This is 2 weeks or longer off work. Yeah.
I mean, like, there's an interesting question that I think you touched on when you and I spoke last week in preparation, which is, from an insurance perspective, Jason. I mean, what sort of interest are insurers taking on this proactively in terms of things, organisations? What are the types of things an insurer would be looking at to sort of have a level of confidence and potentially even a discount for organisations, so that they're not being sort of pulled into that from a premium increase perspective? Because you can't go $1 billion over or 304 increase without premiums going up at some point. So what's happening in that dynamic?
Yeah, it's interesting, right? We actually partner with a number of insurers like Zurich, EML, DXC, Claims Management, and others. But we're starting to have the conversation with them now where they are really interested on like, well, how do we incentivize employees to do the right thing? And is it a discount on their premium by demonstrating they're doing the right thing? So those are early conversations that we're having. Largely what we're finding insurers have appetite to do either through their brokerage or, the broker that they work through or directly is to fund clients to work with us to help them to build up systems around psychosocial risk management. So yeah, we've received a fair bit of funding directly from insurers to say we've got a troublesome client that we're getting a lot of claims from. Can you work with them to develop a good system here to prevent these injuries from occurring? But there has been discussion regarding discounts to premiums based on companies doing it well. Haven't seen that flow through yet. And like you say, then like what would an insurer actually expect a company to do beyond maybe just improving lag data and reducing the number of injuries that are coming through? Like what else could they do to potentially demonstrate to the insurer that they're doing the right thing?
Right. And so again, whilst we've got regulations, and I know New South Wales have got various sort of tools and products in that space, there isn't necessarily a model compliance tool that people can apply that says they're been certificated against or anything like
Well,
that.
I mean, they could be, right. And that's definitely something that we've directed insurers to think about. So many on the call here, given it is a health and safety forum, would be aware of the ISO standard 45001 for health and safety management systems. There is a child standard that came out in 2021 for that, specifically focused on psychological health and safety, ISO 45003. And what we're seeing is that there are some auditors or accreditors of those certifications that will actually separately certify that you have met the requirements for ISO 45003, right, which demonstrates that you at least have a system of work in place, right? And then over time, companies need to operationalize that. And we actually are working with some organizations, some multinationals who have been certified to 45003. And you can do that like a quality management system or a health and safety management system by getting all your policies and kind of processes in order. But at some point, before the auditor comes back, you need to operationalize that and go, yeah, this is our evidence that we've consulted with workers. And this is our evidence that we have, put in controls in place, thinking about, work redesign and that sort of thing. So we're starting to see more organizations who are certified reach out to us going, okay, we've got all our systems in place, but we haven't actually operationalized this yet.
Yeah. Okay.
But there is something there, Francois, though, that insurers could talk to and go, yeah, at least they've got the systems in place. Nice. And then ultimately, if they maintain certification, they will need to go through those cycles of continuous improvement and evidence that to an external auditor.
Nice. And like absolutely shameless call out here from a forum perspective, that the forum's core frameworks that Dr. Hilary Bennett helped us with are sort of ISO 45003 aligned or adjacent. So there's a nice level. I think when you follow the evidence, Jason, things tend to align, right? I mean, isn't that the beauty? Look, I've got one more system question, because there's a couple of questions coming through that I think are getting us back into let us get around the board table in our organizational context. So I guess my last system question is, can you give me a flavor of what are we actually seeing the regulators going for? And I guess the anxiety is, how do we make sure we're there's a question here around elevation of where the regulators are paying attention, because I think there's a concern here that they'll just go for the lowest hanging fruit, not maybe to where other, from a governance or primary duty of care perspective. So is there anything coming through that you could tell us around where regulators are sort of aiming their direction, what they're seeing?
Yeah, and we all know, like, whether you're in a company or a regulator, you've got constrained resources and you can't go after everything all at once. You really have to go, well, where is our efforts best spent? So we recently had a couple of people from Safe Work New South Wales who are on the sexual harassment task force come on and share what they're doing, and they're very much taking a risk-based approach. So they know that, people working in accommodation, retail, hospitality are more likely to be subjected to sexual harassment, sexual assault than people working in other industries. So they are very much focusing their regulatory activities on those industries at the moment. There is very much, that's what they're looking for at the moment. They're going, but they've got evidence that kind of is pulling them to certain sectors, if you like, where they can make the biggest impact the quickest. You know, high populations of workers, a lot of potential for harm. Like, let's focus our attention there.
And I mean, okay, I said last question. This is the last question. How big are the squeals or applause from industry generally around this?
I don't think there's necessarily squeals. It's, even though this has been in the works since 2018, right, and people should have seen it coming, there was a little distraction around 2021 where people were maybe thinking about like a global virus rather than thinking about psychosocial risk management.
Very cool. Yeah.
But they should have seen it coming. But we're seeing a lot of organisations. It feels like they're being caught on the hop a bit and going, well, okay, well, we didn't know about this, and now we have to do something about it, and we've got no budget. So this is largely an unbudgeted item for many organisations in Australia. So they're unfortunately largely lumping that on overburdened health and safety people who thought that they could just get back to normal and get some of these other programs of work up that they had to put on hold while they were dealing with, pandemic response. But now they're having to take up on psychosocial risk, and a lot of them just do not have expertise in this particular area, and the companies aren't actually releasing any budget for them to be able to bring in an expert or tools to help them to achieve the outcomes that they need to achieve. So we operate, like New Zealand does, July to June tax year. So we're seeing a lot more organisations actually requesting budget for, to do work in the next financial year. I think, and that's just a maturity thing, right? But at the moment, we're seeing that these poor health and safety people are having to try to pull budget from different places to try and do something in this space when they're under-resourced and don't necessarily have the knowledge or capabilities to do it themselves.
Nice. Okay. Well, maybe that's quite a nice segue in terms of hard-working players and organisations working hard. If we go back, mate, put it into your client base and what you're seeing actively across the organisations you're working with, one of the questions that's coming through, or a couple of questions around this issue, is sort of the perennial. We manage what we measure or monitor. I often think may be useful in this space. And so, if we want to get beyond how many measuring failures, what are you seeing in terms of useful lead indicators, lead measures that actually give organisations a chance to get their arms around this and do that monitoring you're talking around impact?
Yeah, let me share some slides actually, because this is something that I'm particularly interested in. And back in 2017, 2018, when I decided to specialise in this area, that was the main thing I saw that was missing. Unlike other hygiene factors like noise or dust, where there are monitoring devices, right, to be able to tell us as objectively as possible what is the exposure that employees have based on the severity, frequency, and duration of exposure to harmful elements. What then is the risk of harm occurring? There was actually nothing in that space for psychosocial risk. Like you say, a lot of it is subjective, or we're trying to, pull other data, like from a culture survey, for instance, and go, well, what does that tell us about risk? But what we found that, there weren't any really suitable tools that would actually quantify the risk effectively. And a lot of this comes down to understanding where does risk exist. Because what we found in the past when trying to understand, risk of harm, there's been a focus on either the individual. So let's measure how resilient they are, or let's measure how stressed they are, or let's measure, their depression or anxiety symptoms. There's been another line of work which has been very much focused on how do we measure the design of work, and some of that might be captured in an engagement survey, for example, where you measure things like perceived supervisor support, work overload, or like decision-making latitude, things like that. And we have tools like in Australia, the People at Work tool, for example, has been designed to help measure work design. The problem is that risk doesn't exist in either the individual level or the design of work necessarily. It actually exists where there's a mismatch between the individual and their preferences and the design of work, that bit in the middle. So what the tools are either doing is either measuring the individual or the design of work, but it's not measuring the mismatch. And so what we did, given, like I said, I've been working in the human factors space for a bit myself, so I've got like beyond organizational psychology, a good understanding of like how do you apply occupational hygiene thinking to something like psychosocial hazards. We felt that we really needed to rethink what are we trying to do to get to that risk point. And there's a few things, right, that you need to think about in assessing psychosocial risk. And it's, again, not about identifying individuals who are mentally ill, but it's about identifying the systems. What is it about the design, management, or social aspects of work that have the potential to cause harm? And you would know this, Francois, as well as anyone else. Just because you haven't had a fatality doesn't mean there's a risk of a fatality occurring. You might have just been lucky. So what foreseeable risks do you have in different aspects of work that might cause harm? You can't just rely on lag data. Exposure, it is an exposure issue. It's not just about does workload exist. We need to know, okay, well, workload does exist, and to what degree is exposure to that causing people to become stressed, overwhelmed, angry, or upset? And then if it is causing them an impact, then what is the frequency and duration? It's very similar to noise exposure, right? Like going to a concert once off is not going to lead to lifelong hearing damage. But going to a really loud concert every day for a month or 2 months on end might actually lead to permanent hearing loss. And it's the same with psychosocial hazard exposure, unless we're talking about something like violence or exposure to trauma. One-off exposure generally isn't causing harm. It's that ongoing high levels of exposure. But then, unlike physical hazards, it's not. Most psychosocial hazards actually don't work independently. They interact and combine in order to cause harm. So many people will look at things like work overload and go, well, what degree is work overload causing harm? Well, work overload, if it's buffered by a great supervisor, awesome colleagues, good decision-making latitude, that can buffer the effects of the work demands. Mm-hmm. So we really need to think about multiple psychosocial hazards and understanding interactions. And I spoke about that or wrote about that on LinkedIn just this week, talking about bullying and harassment. There's often a focus on the bullying and harassment without thinking about, well, why are people more likely to bully or harass their colleagues? Is it because they're overloaded? Is it because there's no role clarity? Is it because there's broader systems that are broken within the organization? So we need to think more about interactions when it comes to psychosocial risk than what we do with physical. And as we've been talking about, it's about taking a risk-based approach as well. So it's about hotspotting. Unlike an engagement survey where generally every leader would get their data and they'll be told, okay, develop an action plan. What we really want to do, as the regulators are doing, is identify where does risk exist and then making sure that we really prioritize those areas. Mm-hmm. So I guess what we have done is actually then gone, well, how would you apply exposure thinking to understanding psychosocial hazards? So rather than asking 3 or 4 questions and asking people to, strongly agree to strongly disagree, we actually show a psychosocial hazard because this is a risk assessment. We want to assess the risk of hazards causing harm. So it's not a positively worded item or a neutrally worded item. It is a psychosocial hazard that we're presenting. And then we want to know the severity. So what degree of negative wellbeing impact have you experienced in the last 3 months? Frequency and duration. But what we're finding is that when we take individual employees' responses to this, right, aggregate them up, but also think about multiple hazards that they're experiencing. We've created an exposure algorithm, if you like, at an individual level that has a very linear relationship with both health outcomes as well as productivity outcomes. So regardless of whether you're interested in health outcomes or not, as a CEO or business leader, ultimately you will be interested in productivity outcomes, particularly things like attrition, because there is a direct cost associated with that and quality and reputational issues associated with that as well. And this is a thing, I guess on a tangent, Francois, that we're seeing has been probably a limiting factor in psychosocial risk management, psychological health and safety, actually resonating at the board and exec level. And that's because we're not talking in the same language. People keep talking about the moral obligation, and this is a good thing to do. But boards speak in the language of risk, and we haven't been able to quantify the risk so that boards can set their risk appetite and go, well, what level of harm or what level of attrition or cost to productivity drivers are we willing to accept based on the experience of work that people have? And so now we can work with clients now that we can get this data and go, well, are you willing to accept 43% of your workers burning out? Great. Okay, Elon Musk might accept 77% of his workers burning out. But are you like willing to accept, 43% of your workers quitting in the next 12 months? Would you much prefer 15%? Okay, so once we set what is the target in terms of our appetite, then we can start thinking about, well, what are the hazards that we most need to concentrate on, and in what parts of the business do we most need to concentrate on in order to bring down those outcomes to a level that's within appetite. So yeah, this is it's something that's been missing for a really long time, and we're finding now that this sort of data is now resonating at that board and exec level, because now they can make risk-informed decisions based on quantitative lead metrics rather than, just going, well, we believe it's a good idea, but, it doesn't really fit into how we make decisions at board level.
And that's been informed, Jason, that's applied data that's actually informed that algorithm that you've identified there with that matrix?
Yeah, sorry, I've been talking for so long I forgot what the original question was. But yeah, I was asking about clients and their kind of experiences, and that's what we're finding, right? So we're really fortunate to work with some, of the largest employers in Australia, like Rio Tinto and Qantas and Linfox and companies like that. In New Zealand, if we're thinking locally, they're ahead of the game. Like, it's not the regulations in New Zealand, or there is none that is driving them to do this, but they're really thinking about this is best practice and that's what we want to adopt. But it is changing the conversations they're able to have internally, and by a lot of them just piloting with smaller groups and then like elevating that information up, they're very quickly being asked by execs to go, well, can we do this across the business or in other elements?
So Jason, just to go back, so when you were talking about the exposure and the interaction, and they're the areas where you're saying you can develop lead measures around you do your measurement or indicator development in those areas, in those buckets. That's where you can start to get curious about how would we measure or monitor or be aware of situations where we've got interactions of high workload spiked with low levels of supervision, for instance.
Yeah, and absolutely, we can do that, and that's through consultation with staff. Still, one of the hesitancies of leadership in organisations wanting to consult with staff is they're like, well, if we've got our heads still stuck in the stand, there's no problem. As soon as we start asking people if there's a problem, we're going to find out about all these problems that we are not resourced or have no appetite to actually address. And so what we're trying to show is what is the cost of not doing anything, right, in terms of health and productivity impact. And we can actually now even calculate, well, what is the cost of targeting an intervention? So we've got a really cool algorithm that you can go, well, if we reduce work overload by, say, 10 on a 100-point scale, what does that then do in terms of predicted burnout, job dissatisfaction, turnover? But I guess to that point, what organisations who are starting to sink their teeth into this is that there is so much low-hanging fruit, because we haven't done this well historically, that a lot of the interventions we can action very quickly with no cost. What we need to focus on first and foremost is what's known as hindrance demands. So when we talk about types of demands that workers have, they're either challenge demands, which motivate people, so working to a deadline or extending one out of one's comfort zone. Those are challenge demands which can actually motivate people and get them really focused. Bearing in mind, if people are engaging that stress response for too long, it still can cause them to burn out. But hindrance demands serve no other purpose except to make people frustrated and angry. And it's those things like, overly bureaucratic processes, technology that doesn't work and makes our life more difficult rather than easier. There's always these things. And the easiest way to identify those hindrance demands is actually to talk about workers around, okay, we have identified in your particular group that work demands are being perceived as higher than in other parts of the business. Why? And if you could change two things about your work, what would they be? So there's
the productivity connection at that point's a literal slam dunk, right? I mean, I think embuggerance is the technical term, Jason. Look, maybe you might have touched on tipped into this conversation. I guess I'm always interested. I mean, what are you seeing as sort of are there sort of a top one, top two, or three sort of regular pitfalls you're seeing organizations stumble on around how to really step into this space? I mean, one of them, like you said, is maybe a reluctance to find out things that we can't do anything about or afford to. Anything else come to top of mind that leaders could be aware of here around things that might speak to themselves around what they're anxious with? And
Yeah, I think language is a big thing. And it's either fear of giving people the language because then they'll report more psychosocial hazards, or it's language that people think that they know what they're talking about, but they don't. And probably the biggest example that comes to mind here is this notion of psychological safety versus psychological health and safety. You know, in business circles, psychological safety has hit peak pop psychology, I think, levels at the moment, and it seems to be the panacea for everything. But psychological safety, despite its name, was not developed in relation to mental health or to health and safety. It was developed by a number of researchers, Amy Edmondson being one of them. She definitely popularized the term. But it was very much around how did people come in, bring their true selves, be willing to, contribute to team discussions without fear of personal or professional repercussions. The main area that this is researched in is how do we create, innovation and creativity. And that's why Google and companies like that are interested in psychological safety, because we want everyone contributing to new products and ideas. If you do a Google search, which I've done many times, because people keep linking, if we have psychologically safe workplaces, then we have better mental health outcomes. I figured with the amount of people who are sprouting that, there must be a number of meta-analyses out there supporting that. But there's maybe 2 or 3 articles that I've been able to find with, sample sizes of 200 people or something like that, that have done some level of linkage of mental health to psychological safety. So psychological health and safety is directly linked to health and safety. It's about applying a risk management framework to preventing harm. And it's very much around mental health outcomes largely, right? So when the problem is with this language disconnect is that when health and safety go to leadership and say, we need to do something in psychological health and safety, they'll go, oh, we've done it. And we had this, speaker come in and we've done these workshops on psychological safety. No, that has not helped you to develop a safe system of work to prevent psychological harm.
It may have increased your ability to know where the areas are you need to work on because people are speaking up more, but the actual psychological health and safety work, the mentally healthy work development area, that's a different thing again, is what you're saying.
Yeah, it's so funny, right? We get really caught on this idea that psychological safety is about speaking up. In Amy Edmondson's survey scale that she's got to measure psychological safety, that is 1 out of 7 questions. There's another question in there, which is, I feel safe to take risks in this team. Is this about improving safety? It's actually about improving people's willingness to, I guess, speak up, or not speak up about risk, but to talk or bring new ideas and not feel fearful about that. But yeah, are you saying it's you really have to think about that? Is it a positive if we're talking about health and safety that people are willing to take risks? So yes, I think we should really stop talking about psychological safety in the same vein when we're talking about health and safety or mental health, because there really is not the research support that supports it. So I think, getting the language right is really important. And that maybe is one of the ways to overcome that barrier. And that's education. We're having to do that a lot at board and exec level on this. And then, obviously then funneling that down through the organisation, through health and safety, HR people, frontline leaders, then frontline workers, right? So we really have to get the language right in this space.
Yeah, well, it's interesting, from a forum perspective, we always say, mindset drives practice. How we think impacts what we say and do. And it would be a regular, every week, I would have at least 1 or 2 board or exec engagements where I'm invited basically to have let's get our language and concepts in order first. I've got one more question looking at this from an organizational perspective, Jason, then I've got 1 or 2 other questions I want to get to. One, maybe we'll do these reasonably quick fire. Is there anything, this is clumsy, so excuse the bluntness. Is there 1 or 2 frequent flyer recurring psychosocial risks you're seeing, no matter what the organization, that are the sign of the modern age? that if I even if I didn't do the full process now, I could probably have a that gnawing sense in my stomach. That's probably true for me too. What are you seeing organizationally coming through as high flyer psychosocial risks that are common?
Well, yeah, I'd say there's three, right? Work overload is probably the most, well, undoubtedly the most common one that we observe. And you know what? In our data, work overload, low job control are the two that are most clearly linked to psychological harm. Not actually the best predictor of turnover intent. It's actually lack of reward and recognition, which is actually the highest predictor of turnover intent. But work overload, low job control both drive things like burnout, but work overload is more commonly observed than like low job control. The other ones that come up, and I guess, like you say, signs of the modern age would be things like role ambiguity. With how things are moving and how quickly roles are changing, sometimes the workers doing the job aren't actually kept up to speed with either how their job has evolved and job descriptions become out of date really quick, or what are the priorities of the business, which might change on a monthly, weekly, even daily time frame. So it's really important that we attend to those. And we're seeing those things interact. And the other thing, I guess, is leadership support. With the amount of people doing hybrid work arrangements and that sort of thing, leaders who had that command and control style where they needed to be able to see people in the office and be able to directly interact with them in person in real time. They're having more difficulty, I guess, managing people who are working hybridly or asynchronously. So there's a gap there with the new way of working and maybe how leaders have traditionally led. And there's a big gap there. So yeah, if we're talking about things related to the new world of work and the common hazards, work overload, role ambiguity, and poor leadership support.
And equally as blunt and clumsy, any frequent flyer types of controls or responses that you're seeing, again, not that we're saying do this and you don't have to do any other work, but anything coming through that would be useful just to give people a teaser, a taster of what's proving effective in dealing with those high frequency issues?
Yeah, so look, the thing is, there's no silver bullet, unfortunately, for controls. I wish there was some frequent flyer ones. We do in our platform have a control library which gives suggestions around, hey, here's some examples of some work design interventions for this particular hazard. But we find almost every time that the hazards are very specific to the context of not even just an organization, but a team. That can be so different from team to team. And then the best way to actually address that is actually very specific to that particular team and how they're working. So as great as it would be to say, hey, flexible work arrangements or a 4-day work weeks are the best way to do it, we can't have that kind of like one size fits all approach. That's kind of like, it's been proven not to work when it comes to mental health apps and that sort of thing, resilience apps. You can't just throw that out to every employee and think that you've done your job. What we do need to be mindful of, and this is where the regulations in Australia have been really great, is it's actually pointed to Org Psych 101. Do a diagnosis, understand the root cause of the problem, do an intervention, even a micro experiment, and then remeasure to make sure that has actually worked. In the past, we've just seen a lot of like slapdash, oh, this has worked in another context as a control. Let's chuck it into this environment and just like expect it to work without really understanding the root cause and then not measuring whether that's working or not. So I'd love to give you an answer to that one, Francois, but it's not an easy response.
No, I mean, I really appreciate the call out around, I think, the use of micro experimentation. I think I saw Tanya, actually I did see Tanya Palmer, hello Tanya, if you're still online. And I remember talking to Tanya and Megan when they were at Contact, and I'm sure the philosophy lives on in Meridian. They talked about thinking big but starting small. And I think that idea of being able to embrace micro experimentation actually works well for this type of issue where it might not be a broad-based antibiotic required to address the issue. Actually, the rest of the body can be left alone, but we need to go here. So I think that's a really nice call out. Now I've got a couple of questions I want to finish off that'll be really quick fire, but there's one in particular I'm keen to get to, which has been a really vastly increasing issue we've been seeing over the last year around violent and aggressive behaviour, both call centres, retail, frontline. Was any of that injury, that violence and aggressive, would have that turned up any of that psychological claimable harm you were talking about before? And added to that, what are you seeing in terms of, are you seeing in Australia any trends about increases of just shorter fuses, shoutier people, and aggressive and violence at work?
Yeah, look, definitely.
2 minutes on that
Yeah,
one, Jason.
yeah,
2 minutes on that one.
So first of all, yeah, here's a quick summary, which I'll share out in the slide pack afterwards, right, of the mental health injury claims made in Australia. And you can see work-related harassment or workplace bullying is, if we're looking at 11,000 claims, about a quarter of those claims. Exposure to workplace or occupational violence, about, 13% of all claims. So yes, violence is, and we definitely, we work with retailers like Coles, for example, and and BP and that, and they are all noting that it does seem to be customers are more aggressive, and it might be the sign of the things that have increased cost of living and more pressures that people are feeling that are then being, acted out on those poor frontline workers who are working in that retail customer interaction. Interesting that Woolworths just launched body cams for all of their stores now. They did do a smaller trial of body cams as a kind of systemic control to kind of de-escalate potential violence. And they're finding, that, that experiment that they did worked well in 17 stores, and now they're expanding that to all stores. Yeah.
In New Zealand too, Jason, actually, though, I saw that they just announced that in New Zealand too. And we've got some trials going to facial recognition technology for people that have been trespassed off properties in one of our other major supermarket chains too. Okay, my last, I'm conscious, people, there's a couple of questions we've not got to. I've got a couple I want to put on because I'm conscious of who's on the audience. So these are a couple of quick fire ones, Jason. We've got a bunch of health and safety leads, health and safety functional advisors, heads of people, heads of culture. What would your one piece of advice be to them if they're struggling to land this argument with their senior team or board?
Yeah, make sure you're speaking their language. And I've seen so many people try and fail to use ROI and these kind of industry reports of like, hey, if we do a mental health intervention, this is the sort of return that we can get as a business. Most execs will see straight through the assumptions in those reports if they read past the abstract, and they'll cause more questions than answers. The best thing you can do is actually benchmark using your own data. So if you can show you've got high levels of attrition in certain areas of the business, and if you were to improve the attrition in one area of the business back to the benchmark within your whole organization, the average across your whole organization, what would be the cost savings? And you can do some stuff, some low level consultation with, just health and safety reps or other, worker reps to find out, well, what are the key issues in those particular areas? So, use your own data if you're going to make an ROI debate at board level, because they'll see through the assumptions of any like a Deloitte or PwC paper. But then also make sure you're speaking in the language of risk. What is your risk appetite? Ask them. And even take them through a bit of a process to help them to understand what are you accepting if you're accepting a certain level of risk, because boards don't have that information at the moment.
Great. And we've also got some CEOs, and I know we've got some directors on the call too. What would your one advice piece be to them around making sure they're asking smarter questions or being more curious in ways that are going to be helpful for them and their work, but also in support of their team?
Yeah, ask for better data. One of the big obstacles we have at the moment is that HR own the main employee consultation tool, which is the employee engagement or culture survey. And because largely those processes, I'm going to speak for the majority, not for everyone, but the majority of the time, it sounds like those processes are run very poorly and there's not really great action taken on the back of it. People don't see their experience of work change on the back of an engagement survey more often than not. That leads to survey fatigue. Survey fatigue is not because people answer too many questions. It's because of learned helplessness, or survey inaction fatigue is generally the cause. So what we need to do is to say to those people, well, look, we're not necessarily, if we're talking about mental health risk, you're not going to get the right information from those sort of tools. If you are going to be bringing me this information, I need to know what is the risk. CEOs should be directing people to give them the right information. And largely they're not able to do that with the tools that are there. But just asking the question, hey, give me a good understanding of the risk and quantify that for me. And and then leave HR and health and safety to work out the best way to do that.
Nice. Well, look, Jason, I'm gonna draw it to the close there. We've got a bunch of questions we haven't got to between me and my team here, and we might even get it's subject to what a few of them look like, some thoughts from Jason. We'll get some information back to everyone out of those. We're going to be sharing Jason's slides. We've got a few other resources we can share. I will be getting those to everybody presently. Kate, if you just want to quickly put the poll up for those people that are still with us, conscious we're leaving, just to get a bit of feedback on the on how today was for people. Jason, I just want to say thanks again. What he didn't he very kindly didn't say I broke the record for the longest podcast contribution when Jason got me involved, which will be of no surprise to people that know me well. But Jason, you've been on point, you've been concise, you've been insightful. Really appreciate you lending your support. All the best for your conference. We'll make sure there's some information on that, and we encourage anyone that's interested on doing their own education and development to get over to Sydney and support the work that Jason and his team's doing, and I guarantee they'll learn some stuff. So thanks very much, Jason. Really appreciate it. We've got another couple of calls. We've got our own Dr. Hilary Bennett's going to be joining us on 30 May. And on the 26th of June, we've got another Western Australian, Jason, a guy called Graham Wright. Graham's going to be talking more around physical well-being and physical health and its impact in a work environment. So we're going to be continuing to roll these forward. Thanks everyone for your support and time. Jason, big thanks from me once again. And thanks to my team for their support in making this happen, both Kate and Summer. All the best. Everyone have a great day. Go well.
Thanks, everyone.
Cheers.